Hello, this is Amber Fee, a reimbursement specialist with the Small Business Education and Entrepreneurial Development, or SEED office. Today I am going to do our third webinar on medical codes, and this webinar is on CPT codes. It is important for innovators to understand how medical billing codes fit into their reimbursement strategy, and it is also important to know what current procedural terminology codes include, as well as where to find them and how they are applied. Our learning objectives today are to understand the CPT code categories and how to find the appropriate codes for your device, as well as to gain familiarity with remote physiologic monitoring and remote therapeutic monitoring codes. Medical coding is an integral part of an innovator's reimbursement strategy. Finding the right code for your device or requesting a new code if necessary is essential. Ensuring that you have the right code for reimbursement for a medical product is as important as obtaining your regulatory approval, because coding is how you get paid. CPT codes describe the services provided by qualified healthcare professionals. This presentation will focus primarily on Category 1 CPT codes. Category 1 CPT codes describe distinct medical procedures or services furnished by qualified healthcare professionals and are identified by 5-digit numerical codes. Category 2 CPT codes are supplemental tracking codes referred to as performance measurement codes. These numeric alpha codes, for example 2029F, which stands for a complete physical skin exam, are used to collect data related to quality of care. Category 3 CPT codes are temporary codes for new and emerging technologies, and they are also utilized to allow data collection and assessment of new services and procedures. Temporary codes are usually in place for 3 to 5 years before a decision is made as to whether or not they will become permanent codes. The CPT book is divided into 6 large sections of Category 1 CPT codes. They begin with evaluation and management codes, then anesthesiology, followed by surgery, radiology, pathology, and laboratory, and end with medicine. Evaluation and management services include office visits, emergency room visits, inpatient hospital visits, outpatient hospital visits. These are visits that are provided by qualified healthcare professionals. When you think of these visits, think of encounters with a physician, a nurse practitioner, where they are doing things like taking your temperature, monitoring your respirations, listening to your heart. They are doing all of these things to possibly make a diagnosis. Possibly you have a cold, and so you encounter the healthcare system, so they are billing an evaluation and management service for you. This category also includes telehealth visits and digital health technologies. Remote physiologic monitoring and remote therapeutic monitoring codes are among the most common CPT codes that an innovator is likely to encounter if yours is a device that provides monitoring of patient information and sends data back to a physician. Remote physiologic monitoring is a form of telehealth and covers the collection of patient physiologic data. RPM allows qualified healthcare professionals to track patient health outside of the office with the utilization of a device that transmits that physiologic data back to the physician so that they can make determinations and decisions about patient care. It is very important to remember that if you have such a device, and that is the device that you have created, you are not likely to receive a separate code, a separate billing code for that device, because reimbursement for that device is going to be considered part and parcel of the remote physiologic monitoring or the remote therapeutic monitoring. There are a number of codes that can be billed for the remote physiologic monitoring. The 99091 is the code that can only be reported one time in a 30-day period. It describes the time the physician spends to review and interpret the data that is collected. The 99453 code is for the setup of the equipment. That code can only be reported one time per episode of care. So let's say that there's a patient that comes in and that patient utilizes the device for a 6-month period of time, 6 consecutive months. That will be considered one episode of care. So that code 99453 could only be billed one time in that episode of care. If there is a 6-month break and the patient then begins to utilize the device again, this begins another episode of care, so the 99453 could be billed again. The 99454 is the daily recordings or programmed alert transmission. This code cannot be billed if there is monitoring of less than 16 days in a month. The 99458 is for each additional 20 minutes. It is to be billed in conjunction with the 99457, which is the remote physiologic monitoring treatment management services of the clinical staff, which is the first 20 minutes. The surgery category in the CPT book is the largest category in the CPT book. It begins with the 10,000s and ends up there in the 66,000 range. Surgical procedures are broken down into 13 sections with many subsections in those 13 sections. During surgical procedures, medical devices are frequently used, and their use is considered part and parcel to the overall surgery. Under those circumstances, devices would not have a specific CPT code or HCPC code. Occasionally, technologies used in surgical procedures do have a CPT code specific to the surgery and a second CPT code for the surgery using a separate technology. For instance, a YAG laser is a medical device used during or after cataract surgery to remove scar tissue and improve a patient's vision. Under most circumstances, the YAG laser is not separately billable. It is covered under the primary cataract surgery code of 66984. Example number 2, stereotactic brain surgery uses a computer system to integrate previous images to create a 3D model of the brain to guide the neurosurgery. In this case, you can use code 61781 for the computer-assisted procedure listed separately from the code for the primary procedure. The medicine category of the CPT book is quite broad. It includes every service that is not included anywhere else in the CPT book. So it includes physical therapy, speech, language pathology services. It includes occupational therapy, medical testing services. It includes psychology services, and actually many other areas. As you can imagine, there are many devices that are used in the provision of the services that are included in this medicine category. And these devices probably are not assigned a code because the therapists use it as part and parcel of the service that they are providing, and the reimbursement for those devices is considered already built into the reimbursement of the code. You should be aware that coding for these type of services and devices may change as new technologies are evolving. It is something that is changing every day. CMS and other payers are, really have their fingers on the pulse of this every day, and they are really trying to figure out, as technologies are evolving, how they're going to keep up with this and how they're going to be reimbursing for these. So you really have to just really keep watching in the news and keep watching for any new developments here. In 2022, CMS did establish new codes. They are the remote therapeutic monitoring codes. They are for monitoring, collecting non-physiologic data. In other words, they are for collecting therapeutic data. In addition to therapeutic data that can be monitored with the device, they also allow for self-reported data input by the patient. The data is expected to be transmitted, though, back to either the therapist or the physician, because there must be a connection back to the healthcare professional, and that healthcare professional must be utilizing the information that is collected to make some sort of a determination in the patient's care, because there must be medical necessity in order for there to be a billing for the remote therapeutic monitoring as well as the remote physiologic monitoring that was discussed earlier. So as with the remote physiologic monitoring, there are a number of codes that can be billed with the remote therapeutic monitoring. There are, of course, the setup codes. There are the monitoring codes, the daily recording codes. With the monitoring codes, there's the first 20 minutes, and then there is the additional 20 minutes. Again, there's the initial setup code that can be billed one time per episode. So again, if someone is utilizing the device for 6 months and then stops utilizing the device for 6 months and then begins again, that next 6 months begins a new episode of care, and the codes can be started again. CPT Category 3 codes, or T codes. These are temporary codes. These are codes for emerging technologies. Many people seem to be a little disappointed if their device is assigned a T code. This is not such a bad thing. They are assigned a T code to allow for the collection of data to determine if the frequency of utilization is enough to warrant the assignment of a permanent CPT code. It is certainly not the end of the world. Many times payers are willing to reimburse the utilization of a device or a service that has a T code or has been assigned a T code. So certainly nothing to worry about if your device is assigned a T code. It may well be reimbursed. Key takeaways from our webinar today. Many devices will not be assigned a separate code because they are considered part and parcel of the service that is being provided, and their reimbursement is considered part of the reimbursement for the service. Remote physiologic monitoring codes are a form of telehealth, and they are probably among the most common codes that a medical device innovator will encounter. A new category of codes, the remote therapeutic monitoring codes, were established in 2022 and are applicable for monitoring and collecting of non-physiologic data. These are also codes that innovators are likely to encounter. The Category 3 or T codes are used for new emerging technologies, services, and procedures, and a T code may in fact be assigned for a new device. Thank you for listening to the webinar. On the screen, you will see some options for connecting with the SEED office. On the left-hand side, you will see some web addresses for connecting with us. And on the right-hand side, you will see the option for signing up for NIH and SEED updates, as well as the NIH guide for grants and contracts.